Okay, so we talked a little bit earlier about comprehensive eye care, and let's get into that a little deeper. So what's that mean for me when you say, we offer comprehensive eye care?
So in addition to comprehensive medical services, as well as routine vision services, the optometry clinic also offers visual rehabilitation services. So for veterans who have a vision impairment, and their acuity or their peripheral vision is reduced and it's affecting their visual function, their ability to do the things that they need to do, we'd have them see one of our vision rehab specialists, a low vision optometrist who has specialized training in this area. And they would work with them to see what their visual goals are, as well as to find the right types of devices that would help them to function at their highest level of independence safely. Unfortunately, there are a lot of medical eye problems that result in irreversible vision loss, such as macular degeneration and diabetic retinopathy. And for patients who have significantly reduced acuity, devices that require visual cues may no longer be appropriate, and they may be utilizing different types of audio devices. And we do actually a lot with Echo and Alexa.
I see.
We also will do computer systems that have optical character readers. So they'll have a book and they'll be able to put the optical character reader over it, and it will do talk to text back and read it back to the patient, the veteran.
Now, I've got an uncle who's got major eye problems, blind in one eye pretty much, and he's got this machine that they've given him. What am I looking at when I see him playing with that thing?
So there are different types of video magnifiers that either are portable or stationary. And a lot of people will like the portable video magnifiers because it allows them to go out into a supermarket or a store, and basically it has a video camera. Okay. And you can reverse the contrast so it doesn't have to be black and white. So, if the person finds that a particular different color background's better for them with different color print due to glare, they can change the background as well as the print. And basically, they're using it like a video camera and magnifying it. They can take a picture. They can blow the picture up. They can read the text.
I'm allergic to certain things, so
right?
I'd want to know that was in the ingredients.
Right.
I can now see that.
For a lot of people, they might need to know the sodium content, the calories, the price.
Yeah.
They just want to be able to read the label. And these are very, very, very helpful and can really make a big difference for a lot of people. What the VA does also offer is something called talk scripts. So for a veteran who is visually impaired and cannot read their medication labels, they're barcoded, and then they have a device that will say, this is your lisinopril, take 5 milligrams once a day for hypertension. So that way they're able to be, fairly independent in terms of managing their medication. We have talking glucometers for diabetics. If they're not able to, see the markings to drop their insulin, then we have insulin pens. So, there's a lot that goes into it. And I think that goes back to what I said about why I love working for the VA, is that collaboration and that ability to be able to help the veteran and interact with their other providers to try and come up with a solution.
One-stop shopping. That's essentially what we're looking at. I'm able to come into my VA facility and I can get my glasses, or I can get this reader. There's, instead of going to 5 different people, I can get it all in one spot. And I think that's very important. That's a big thing about the VA, I think, in my book, is how I'm able to access things like that, where I don't have to make, 4 different stops at other facilities around my state. I've got to go over here to see my doctor, and then I got to go over here to buy this thing, and I've got to go over there to get my meds. I'm coming into my facility. I'm getting almost everything I need done.
Well, and there's good communication back. Yes. So, the patient will see the low vision optometrist. The optometrist will come up with a care plan in terms of different types of devices that may be appropriate. they're going to have a blind rehab specialist who's actually going to come out and, help that person learn how to use those devices. There's feedback back to the optometrist, yes, this worked. No, this didn't work. So they're going to brainstorm and maybe come up with another solution. The other integrated approach we have is for our polytrauma veterans, who have traumatic brain injury, in terms of the fact that that's an integrated team that has neurologists and speech language pathologists and physical therapists, as well as optometrists, trying to address all the different sequelae and problems that a veteran may have related to either a traumatic or acquired brain injury.
Wow. So we go far beyond just a pair of glasses. I mean, that's
correct. Correct.
And again, that's what I find.
And a lot of times
wonderful.
people come in and say, I just wanted a new pair of glasses. And we say, by the way, are you diabetic?
Right.
Did you know that your eye pressure is high and, you may have glaucoma? So you're right. I mean, sometimes people come in and that is all they want and all they need. And other times they come in and that might be all they want. And we say, well, we're happy to do that for you. And by the way, we also should address this other issue.
Right. That's great. That's because that's what needs to be done. We should be caring for our veterans this way, where we see these issues and we can call them to task and say, all right, we got to get these things done with you. And again, one-stop shopping. I just love that part.
The free VA New England mobile app is empowering those who served our country like never before. Access up-to-date information on benefits, healthcare, home loans, and more. Search VA New England in your app store today and access the benefits you've earned and deserve.